Hi, I'm Dorothy Merritt. I'm an internist in Dickinson, Texas. I work with a group of primary care doctors, and I've been doing chelation for about 20 years. I'm here at ACAM because I'm one of the CAP Chelation Advanced Protocol trainers for ACAM, along with Lynn Patrick. And we've been doing it together for a couple years, doing the whole session, but we've both been teaching for probably 15 years at least with ACAM. I'm a fan of chelation because approximately, 20 years ago, I ended up coming to my first ACAM meeting, and it was the most interesting group of forward-thinking, out-of-the-box people that I'd ever met. I got into chelation because I was researching an amino acid called cysteine, which turns out to be a metal binder, and I ended up on the ACAM website, and of course I was just out of my training, and I was like, chelation, oh my God, that's fraud and abuse, it doesn't work, I know that, that's what everybody says. And so, but then when I saw 22 pages of references to good studies, and I saw 22 pages of legal references, I thought, man, there must be something wrong here, because this is such great stuff, yet there's all this legal stuff. Anyway, I came to my first ACAM, and I've been hooked ever since. So when I first started chelation, I didn't really know who to pick, but people picked me because my name was on the ACAM site. I had a lot of people with cardiovascular disease. And then as time went on, and I realized that lead and cadmium were really the cause of, the chelators actually take those out, and because of that, the cardiovascular stuff improves, and as well as many other chronic disease processes. So over the 20 years, I've evolved into, I test for lead, people that are diabetic and have vascular disease, I always talk to them about chelation. At various points in my career, I've chelated up to 30 people a day. I had these chelation centers of Texas that were all around Houston, and they, after I'd seen them, then people just showed up for their chelation and away from my main office. So I've done it in lots of different ways. Now I just do it at the location that I'm at. I'm in semi-retirement, and we do probably 10 people a day, and that's where I'm at now. And so I teach others. That's my big thing now, is I teach others to do this therapy. Okay, so now we've had a national trial called the TACT trial, or TACT, the trial to assess chelation therapy. So now more people know about it, whereas before it was an alternative therapy and it was kind of on the fringe. But now we have a National Institute of Health full study where 55,000 drips were done, and it showed quite an improvement over standard of care for post-MI patients. Well, now cardiologists are referring to me, and I think within the next 5 years, when TACT 2 is completed and published, you'll have much more mainstream doctors performing this as just routine in their offices. And I think lead is a bigger problem than people ever realize. There have been some big publications in the last year showing that it's the silent killer in the United States, and these are in Haynes and CDC studies that are mainstream. So I think we're going to see people learn how to do this treatment. It's not complicated, it's just complicated in people's minds, but it's not complicated to hang these drips and take care of them. But you do need to go to training and know what you're doing, but it's really not that hard. When you have people that are over 50 who have hypertension, autoimmune disease, chronic medical problems, you should probably do a lead level. And then you should, particularly in anybody that is diabetic and has vascular disease, you should definitely consider doing chelation or sending them to a place that does.